Hi, I'm Gina with Utah Family Voices, a project of the Utah Parent Center. As an organization, we are striving to give you timely and valuable information while we are all in this pandemic known as COVID-19 or the coronavirus, and of course, the earthquakes and aftershocks that we continue to experience. We have information at the Utah Parent Center about emergency preparedness, so I'm going to briefly highlight a few resources that we feel are important to know about and use if and when needed. This is a tough subject because all of the fears we have about our children and loved ones with disabilities, special healthcare needs, and complex medical conditions. I'm hoping by giving you these tools and resources, it will help you plan and give some comfort knowing that you'll have the vital information if ever needed during these uncertain times. It is during these times that it is crossing many of our minds of what will happen if my child or loved one gets sick, or what if I, as the primary caregiver, get sick or is unavailable. The following will help you prepare. So some of the vital information to have would be the main diagnosis or diagnoses. You don't have to list everything, but list what you think is crucial for any emergency room or hospital professional to know, as well as the medications, not only the name, but the dosage, how often it is given, and how it is given. Allergies. Allergies in themselves can be life-threatening, so make sure you're listing any allergies to food, medication, or even the tape that is used in the hospital setting. Mobility. Is your loved one or child independent and can move about freely? Or do they need assistance? Or maybe they use a wheelchair or other mobility device. Communication. This is especially important if your child or loved one is nonverbal, deaf, or hard of hearing. Write down as much as you can about the best way to communicate, as well as listing out prosthetics, appliances, or technology devices that your child or loved one uses, as well as writing any of the typical settings for those devices or appliances. Also, behaviors. Many of us have family, loved ones, children with challenging behaviors. So what techniques, tools, or suggestions do you have to calm your loved one or child, especially for the fact that they may not see anybody familiar during a crisis or emergency situation? Also listing out the daily needs and procedures. This can be anything from sleep, toileting, nutrition, including G&J tube feedings, any therapies for range of motion, such as physical therapy, as well as respiratory therapies. And listing out immunization. The full picture of the medical history will only help again in this crisis situation. Writing down the primary contacts, of course, of you as the parents or the guardians, but as well, make sure that you have your primary care doctor and specialists that have the critical information about your child or loved one's own healthcare needs that will help inform treatment. Their baseline statuses, and what I mean by this is your child or loved one may have very different typical baseline statuses in vital signs, neurological, and physical statuses. So as much information, again, that you can put down would be most helpful. Likes and dislikes. This information is as important as the medical information, especially if your child or loved one is nonverbal or has a hard time communicating. Provide as much information as possible on how they express themselves, how they calm themselves. Also, what does it look like if they are happy, sad, scared, angry, or in pain? Because we know that it differs greatly from person to person. Do they have sensitivities to touch or certain noises? Make sure you're putting that down. And again, is there any calming techniques used? Insurance. List all health insurance you have available on the information. Medical power of attorney. This is especially important if your loved one is over the age of 18 and there is not guardianship. If possible, have more than one person listed, such as another family member or close friend, that can help make medical decisions based on the individual's and family's wishes for the best care possible in the event that, again, you as the parent or guardian are not available to help direct those decisions. Code status. If your child or loved one has a do not resuscitate or a physician's order for life-sustaining treatment form, make sure this information is available to be sent with your child or loved one in the event they are in the emergency room or hospital setting. Many of us are getting so much information through television, social media, or other sources, and much of this is contradictory, which leaves us feeling very confused of what to do for our families. I highly recommend going to credible sources such as the Centers for Disease Control, the State Health Department, the Governor's Office, and your primary care provider. In the event of an emergency and you have a a question that you need answers to, your best information and source is from your healthcare provider. While the vital information topics that I gave to you are not all inclusive, you know your child and loved one best and can put the information you think would be helpful to care for them in the best possible manner in an emergency situation where you may not be able to be there to answer all the questions. I'm giving you some of the top resources here to help you get information put together in whatever way is best for you. There is not a right or a wrong way. The important thing is to have all the information written down and make multiple copies, making sure that there is always a copy with your child or loved one. I've also given you the websites for valuable and credible information during this crisis to keep you informed. Some of the top ones, of course, are the Utah Parent Center. We continually update any resources for COVID-19. The medical home portal, you can search for a care notebook and you can choose to download the whole care notebook or look through specific pages to make it unique and your own. This is one sample. There are many out there. So choose what works best for your situation. As well as Family Voices National, they continually update their information on healthcare and health policy matters that pertain to families of children, youth, and individuals with special healthcare needs during this coronavirus. I've given you the Centers for Disease Control on their coronavirus piece because that's where you're going to find the best information on what to look for that is all about the coronavirus, or otherwise known as COVID ID. I say ID, COVID-19. This will help you know when to call the doctor, what are the symptoms, and any other helpful information that can keep you and your family safe. Here in the state, we have coronavirus.utah.gov that it comes from the state health department and the governor's office that will give you the local and state information that pertains to us here in the state. This last website is a valuable one. When you go to the website, it will bring up a map of the United States. You can press on the state that you are in, and it will bring up a form that has much of that vital information that we talked about. And you can either use it as is or take it as a template to make your own emergency information form. We hope that you and your family are staying safe and healthy. Please reach out to us at any time for more information, or if you need additional assistance or support, we are here for you. Thank you.